Hey there, and welcome back to another episode of Queer Money Follow Up. Today we are talking on this week.
David's
God,
brand new to this strategy.
I think I'm back on the old Queer Money schedule. Actually, this marks our 21st day in a row of doing this. So I guess I have to give us a little bit of a props for doing this 21 days in a row. We've also been going dry this month, so this has been a very cathartic month for us because John and I are going through a lot of changes in our own life, and it's actually something that we feel really good about, the kinds of changes that we're making in our lives, which is kind of, I think, relates a little bit to what we're talking about today, and this whole idea of transition. John and I are by no means experts in this area. John and I are both cis gay men, and we oftentimes are curious about other aspects of the LGBT community, and that has been one of the benefits for us having the Queer Money podcast, is that we have been able to interview queer people from all walks of life, individuals who have started and sold companies for hundreds of millions of dollars, individuals who are providing some sort of inspiration to the LGBT community, and individuals who are doing their best to actually live their true selves. And for that reason, John and I find it beneficial to invite trans people onto the podcast to help share their experiences with us so that we can learn a little bit about them, about the experiences of trans people, and also so we can craft our messages around the benefits of financial independence and financial security for all members of the LGBT community. So on episode 20, we invited Andi Tremonte, who is a female-to-male trans man who came on to talk about his process of transition. He was in the process of transitioning, and we wanted to talk a little bit about kind of this general idea of the transition process, but also what some of the financial considerations were for individuals who are thinking about transitioning, what they should be thinking about. Before we dive into that, please remember we'd like you to give this video a thumbs up, subscribe to our channel, and click on notifications so that you're aware when we go live, so that you can participate in the conversation. You're watching on YouTube, you know that we do have the chat available. If you would like to ask questions or give comments, we would appreciate that.
And today we're asking our general question
for
everybody in the comments that we'd like to discuss is, what does the average gender reassignment surgery cost? Does anybody know?
Right.
And this is actually something that we covered toward the end of episode 20 with Andi Tremonte. But I think it's, oftentimes we get an estimate of what it costs for transitioning, but oftentimes we don't really hear about how people are itemizing and preparing for that holistically. It's very often that you hear of a crowdfunding or of a fundraiser to help somebody with the cost of transitioning. But it's almost like we don't actually talk about the specific costs and the itemization of those costs. So if you have an estimate of what the average transgender reassignment surgery costs, please let us know in the comments below.
Or even just guess, right? It would be very interesting to see what individuals think it costs to go through the transition process. And we're talking about predominantly the surgery process, and that is the gender reassignment surgery process, because it's a very interesting thing, because a lot of folks don't even take that into consideration when they think about the costs associated with being a queer person. There are different costs associated various aspects of our lives. We've covered things such as retirement. We've covered things such as surrogacy. We just did an episode a couple of days ago about surrogacy, having a family. Well, this is an additional cost that people in our community have to face. And that's why we invited Andi on to come and talk about that, partly because Andi was going through that process and Andi was investigating the costs associated with us. One of the interesting things that we've found with our discussion with Andi was this vast amount of knowledge that trans individuals have to acquire because it's just not available to them. It's not coming to them through school. It's not coming to them through their families. It's not coming to them through their social circles. So they have to go out and acquire this vast amount of knowledge about what it's like to live as a trans person. And for many folks, the transition process is not something that starts when they are starting to transition their outward appearance. That transition process begins many times, years and decades before. Andi, at the time we recorded this, was 32, I think, and talked about how early on in his life felt like he didn't necessarily fit in the places that he was really at. For example, Andi was raised in Utah and was part of the LDS, or the Mormon Church, and oftentimes was involved in the groups for young women, and said, I don't know why I'm there. I just don't feel comfortable being there. And more often than not, even with conversations with his mother, said that he felt like he was one of the guys, which is what John just put up this quote from Andi, which we thought was so interesting. This idea that it's important to remember that when you are transitioning, the people around you are also transitioning, right? Everyone is going through this transition process together. And I think that's why it's important for you to have a social circle of individuals, not just friends, but of individuals who can mentor and coach, and even therapists and doctors who can help you through this process, because it is a difficult process, not just speaking from what we have learned, let alone the experience of going through that. So it's an important process to have that support around you for.
Yeah, exactly. So again, please give this video a thumbs up, subscribe to our channel, and set notifications so you can join us for future Queer Money follow-ups and join in on the discussion. So we came up with, based on this interview that we had with Andi, as well as some interviews we've had with trans folks since our interview with Andi, episode 20, because over the last 5 years we've talked to several trans folks. We came up with 3 tips that we wanted to share on this particular Queer Money follow-up to help you with the financial considerations when going through transitioning. So what was very apparent with us with talking to Andi, as David alluded, there's just a vast array of information that LGBTQ folks or transgender folks need to be aware of when they start considering actual reassignment surgery. And while the ACA does cover some of the costs, there are some out-of-pocket expenses. And so Andi recommended being crystal clear on exactly what all of the expenses are, what are all of the procedures that you're going to need from start to finish of the entire process. We had talked at that point, the Affordable Care Act was somewhat new, and so what was included in that was somewhat vague to some people, and it wasn't really ironed out. And so a lot of people had a lot of questions about what was being covered or what would be covered for transitioning. And Andi said in the interview that, which I thought was really compelling, was that there are some procedures with transitioning that you don't want to stop halfway. Stopping halfway could actually open you up to greater medical risks or even fatalities if it's stopped mid procedure. You need to complete that. So what that means is that not only can you not stop the procedure, but you need to be able to finance that particular part of the transitioning from start to finish. So you need to make sure you have the money before even going into that. And of course, that makes transitioning cost prohibitive for some people, or delays transitioning for some people. But you also, you want to not increase your health costs or healthcare costs down the road, or even open yourself up to a fatality.
Right. It's one of the things to be very clear about is to do that thorough research, right? There are more and more insurance companies that are covering costs associated with the gender confirming surgeries, but still that means that you have some financial obligations, right? So for example, John and I have healthcare, and for our healthcare, there is a monthly payment, and then there is an annual deductible, right? And that annual deductible, we have to meet that before the insurance companies kick in and start paying. Some of the insurance deductibles, in order to keep your monthly costs low, the deductible is very high. So, for example, on one of our previous plans, our annual deductible was $14,000, which basically meant that John and I would have to come up with the first $14,000 before the insurance companies would start to pay. So it really, and that allowed us to get our monthly costs really, really low, which was good for us because for us, we don't go to the doctor regularly. We're relatively healthy individuals. So we wanted to keep our monthly costs low and really insure ourselves in case something catastrophic happens. If you're on a plan like that and you want to go through and start the process of gender confirming surgery, remember to check out what your deductible is, because that's the amount of money you need to be saving or setting aside to cover your out-of-pocket expenses for the year.
That particular year. And Andy said sometimes transitioning can take up to 5 years.
Right.
So depending on what kind of plan you're on, you might be having to meet that deductible 5 times. So maybe even now that I'm thinking about it, even before considering transitioning, make sure you're on the most appropriate health plan to provide for coverage for the next 5 years. And so you might actually need to wait until the next open enrollment to reapply for a different to change your healthcare coverage, and then at that point start pursuing what is required to go through gender reassignment surgery.
Yeah. So that was the first point, is do your research. Know what it's going to cost. Know what it's going to cost for top surgery, for bottom surgery. Know what the various aspects are, because it's more than just those two, right? There's other aspects to it. We talked with Finn from Callan Lord on a recent episode of the Queer Money podcast, and Finn talked about the need for laser hair removal, which some insurance covers and some insurance doesn't cover, because when the surgery takes place, having that laser hair removal surgery will set you up for less likelihood of having infections down the road. So that's another cost, right? There's multiple levels of costs. So please look at those costs, plan that out, put it together in a spreadsheet, on a piece of paper, know what it's going to cost. Have a conversation with your doctors, go out and do that research. That's the first one. The second one, John just mentioned, the Affordable Care Act was something that we discussed with Andy on this episode. The Affordable Care Act does now push more insurers to make sure that they are covering transition costs. That doesn't mean that it's going to be an immediate yes to everything that you want to have done under your healthcare provider. Remember, these healthcare providers are learning this too. They're now going through this because of the Affordable Care Act. Many of them now are trying to figure out how they cover these, how they put these various healthcare requirements into their system. And these are large organizations that move very slow, right? Just like the government can often move very, very slow and sometimes take many steps backwards, as we saw 4 years ago, right? So you're going to want to make sure that you're pushing your insurance company to know what it is that they should be covering for you. Don't automatically assume that when they come back and say, no, we don't cover that is accurate. You're going to want to push back on them and say the Affordable Care Act does say that you need to cover this.
Yeah, and unfortunately, Andy said it's not fair and it shouldn't be necessary, but you might actually have to educate your healthcare providers and your insurance company on what is and isn't covered. Again, back to the first point, it's critical that you're crystal clear on all of the factors that go into transitioning, because ultimately this is your health that's at stake, and this is your transition. So as much as providers should be and professionals should know what's required and what is covered, that's not always the case. So you need to advocate for yourself, which can be difficult sometimes, and that's why when we talked to Finn Brigman of Callan Lord, he let us know that Callan Lord and organizations like Callan Lord, which is based in New York City, are happy to advocate for transgender folks to their doctors, their general practitioners, to insurance companies, to explain everything and educate the professionals on what they need to know. And even though Callan Lord is based in New York City, they do advocate for individuals all over the country.
Right. So that's point number 2, that the Affordable Care Act does allow for coverage. Make sure that you are sure what your coverage is before you start the process. You may need to push back on your insurance provider. Then number 3, we want you to be aware of how the transition process may affect your job. Then we bring up these 3 points because we want to cover the financial aspects of them. It's easy to get caught up in the emotional aspects of wanting to go through the transition process. Completely understand that and can relate to that, right? When you come out, you're going to want to be your true self as much as you can be and as quickly as you can be, right? But one of the things that you want to be prepared for is that there is possibly some negative effects from this, and one of those could be with your employer. So you want to make sure that you are sure what it is or how you think your employer will respond. I asked in a rather large trans community on Facebook about when individuals were going through their transition process, whether or not they had a supportive employer, whether or not they waited or went through the process and then got a different job, or whether or not they did this before they were in their current position. And I thought it was very interesting. A large number of trans folks said that they waited until, quote unquote, and this was something that someone put into the poll options, they waited until they had a quote-unquote real job. They waited for getting a real job until after they had gone through their visible appearance transition. And the comments were basically around this idea of they wanted to get through the process before they started their career. That could be possibly a limiting move for your career, right? If you're waiting and delaying for a year or 5 years, that's time you're not in that job or in that career that could delay your ability to earn money at a level that you want, right? So if you are in a career already, make sure you're checking to see that you have a supportive work environment. As the quote from Andi that we mentioned before, when you transition, the people around you transition as well. They're going to go through this process. So do you have a supportive group of people at work? Do you have a supportive boss? Do you work for a company that will be supportive when you're transitioning? That will make the process so much easier if you have that. If you don't, sorry.
Yeah, that's okay. Of course, with the Supreme Court decision from June of 20, we now have LGBTQ protections in the workplace. Again, as we talked about on episode 218 of the Queer Money podcast, we're not exactly sure what that's going to look like in real life. So you still want to be cautious, because what is, as Andi even shared on this particular episode 20, is easier to change laws than it is to change culture and minds. So we're not exactly sure how this will play out. So you do have protections, and we talked about what you might want to consider and practices you might want to implement in episode 218 of the Queer Money podcast, so that you do have some extra protections to make sure you can fight against any wrongful termination if you do find that you've been discriminated against in the workplace.
Yeah. So those are our 3 tips for you. So we want you to make sure that you look at the costs up front, make sure you have a clear picture of what you think it's going to cost you. By the way, back to that original question we asked, how much does the average gender reassignment surgery or gender confirming surgery cost? Andi in the episode said that most folks should look for it costing around $30,000. So you need to do your own research, but we're seeing that this is costing tens of thousands of dollars for individuals to go through the process. That may be part of the reason why we see some individuals taking some of the parts of the process to a certain point and then stopping. Now, that's a personal decision, right? So that's point number one, know what the costs. Point number two, making sure you know what your insurance covers and pushing back on them when they say they don't cover it, because the Affordable Care Act does say that they need to cover it. And then number three, making sure that you are in a supportive environment at work when you decide to transition, so that worrying about money and your job and your lifeline for income is not an additional concern when you're going through the process.
So thank you for joining us for another Queer Money follow-up. Here's your Queer Money follow-up takeaway from this particular episode. Please subscribe to the Queer Money podcast at deadfreeguys.com/QM. Then let us know again in the comments below or in the Queer Money Facebook group, if you're a member there, what you think the average transgender reassignment surgery costs. And then join us for tomorrow when we do Queer Money follow-up episode 21 to cover Queer Money podcast episode number 21, when we talk to DJ Doran, publisher, LGBT publisher, magazine publisher, when we talked about how to take your ordinary to the extraordinary. Lastly, give this video a thumbs up, subscribe to this YouTube channel, and then so you can join in the conversation in real time, please set the notifications on our YouTube channel so you don't miss future Queer Money follow-ups. Thank you, and we will see you tomorrow.